The principal focus of my practice for the last 25 years really has been working with families in terms of understanding the benefits that might be available to them in terms of paying for long-term care. We work with a lot of families every year when they're faced with that very difficult decision of how do we provide good care for our loved one without going bankrupt and losing all the things we've worked so hard for. It can be a very difficult decision to place someone in a long-term care situation. We all hope we can care for our loved one at home as long as possible, but sometimes the realities of the situation just make it hard to fulfill that promise. I know that you want to provide the best care possible for your loved one, but you also are concerned about how do we then have assets and income to continue to support the family. And that's what I find so satisfying about working in this area of law, is that there is almost always something that we can do to help people. Medicaid rules, veterans benefits rules, public benefit rules are complicated, and it's not something that a layperson can even possibly understand on their own. There's wisdom and there is help out there for almost every family. So I encourage people to come and let's talk about this. I think there can be a good deal of fear and anxiety of what is the lawyer going to say, that a lawyer can only bring bad news. And I can tell you that in my experience, there's almost always some ray of hope, something that we can cling to in terms of how do we get the best care possible for our loved one while making sure we preserve assets and income to help those who are still well. I like to tell the story of a woman, and I see her almost every week, who has been caring for her husband at home long past the point when doctors and social workers recommended that she get help. She does this out of a sense of commitment and loyalty, to the point that she may be killing herself trying to take care of her loved one. She also is worried about how much this is going to cost, because when you call the nursing home and they tell you how much it's going to cost, it's devastating. I can provide you, the law provides you with options, and I would encourage you to come in and talk, perhaps sooner than you might want to, just so that we can lay out a roadmap of options. In a situation that you feel that's completely out of your control, you do have options, and we can help you in gaining control of the situation, taking care of your loved one, and taking care of you.